We come to the neonatology unit every week to examine certain babies to make sure that their eyes are developing well.
When infants are in the NICU, they are prone to diseases of the eye that can blind them. But if caught, there's the potential to minimize the damage of those diseases or potentially even halt that disease.
We're looking inside the eye, so we ask the babies to open their eyes. They generally don't do that, so we have to help them. And we use a device called speculum to hold the eye open and so we can look inside the eye. The current devices that we had limitations that we've been using. Either they were too big for the very small babies, or they were a little bit more aggressive than we wanted them to be. We thought about a hybrid of these specula and come up with a new speculum, which I call the rainbow speculum, to open the eyes very gently and hold it gently, and so that would improve the process and make it a little more comfortable for the babies. And so we've been awarded with the Innovation Award, and with this money we actually do have a prototype, and we are in the process of having it produced even more so.
Dr. Orge developed a new speculum that accomplishes the goal of being able to help the infant or the neonate hold their eye open so that they can take a good look, but is also much more gentle. So it's a great example of when one of our best clinicians is there with their patients thinking to themselves, how can I do this better?
Glaucoma is unfortunately a very common disease, and it is one of the leading cause of blindness, and especially in the elderly population, but we do see the same problem in the pediatric population as well. So we have actually a fluid being made all the time in the eye, and there's a drainage mechanism that we all have. So it is a fairly straightforward plumbing mechanism if you think about it. So if the outlet is clogged, then the pressure builds up in the eye, and that makes us go blind.
Dr. Orge had a novel concept that he came up with for a new device to lower intraocular pressure or lower eye pressure for the treatment of glaucoma.
So the device that we came up with, which I call it the FORGE device, or the FORGE device, is made to bypass this clogged trabecular meshwork. There is a new trend on multiple machines or multiple devices coming up that is doing exactly what this device that we came up with is supposed to do, but they're only one tube at a time. The device that we came up with that is actually an area that actually has multiple tubes on it, so even if you clog one, then the others hopefully will facilitate flow as we go.
Glaucoma is one of the top 15 reasons why any patient, any person would visit any kind of doctor for any reason. So glaucoma is actually a very big public health issue in the United States. So this has the potential to help a number of people, not just in this country, but worldwide.
The innovation program that we have here in Rainbow and university hospitals allow us to collaborate very easily. So the team actually receives the idea from us and literally makes it to a product. That's exactly what happened with the rainbow speculum. That's exactly what happened with the FORGE device that we're working on.
Not only is University Hospitals in words happy to say we support discovery, we support innovation, we support research, it is willing to put money and time and also to celebrate people's successes to create a culture of innovation and a culture of discovery. I think that's a very strong statement on behalf of university hospitals.